So I am actually in Taiwan, in Linkou, Taiwan, at the Chang Gung Memorial Hospital, which is probably one of the premier microsurgical hospitals for microsurgical reconstruction, plastic surgery in the world, led by Professor Fu Chan Wei here. And I'm spending the year here as a microsurgery fellow. I'm doing a actual clinical fellowship, and so it's kind of like it's a little bit like the fellowships in the US, where at least for plastic surgery we do 1 year fellowships and we go to a separate hospital and learn anything, like you kind of separate it based on the disciplines of plastic surgery. And so one of them is microsurgery, so you can do a micro fellowship in the US as well, or you can do one abroad, and probably one of the more famous ones is the Chang Gung Microsurgery Fellowship. So I do go to the OR and I do operate almost every day. One of the particular things about Taiwan is that a lot of people here chew betel nut, and it's like this little, it's like if you don't know, or for people who don't know, it's like this nut that grows on their kind of look like little palm trees, and they have certain chemicals and stimulants in them, and so they mix it with things like lime and other chemicals, and you chew it, and it actually, a lot of truck drivers or just manual workers, they chew it and kind of gives them a little bit of energy and a little bit of kind of like a stimulant experience as well, and probably other feelings too. So a lot of people here, it's legal. You can almost see it on every single corner here selling it, and so a lot of people chew it, and unfortunately it's very much linked to oral cancer. So they have a very, very high rate of oral cancer here in Taiwan, and so they do a lot of resections for head and neck cancer, and then where plastic surgery comes in. That's why they kind of built this mecca of microsurgical reconstruction here. I think a lot of it was influenced by the location. So like I mentioned, my whole family is in Taiwan, and my parents, they grew up in Taiwan. They moved over to the US about 40 years ago. And so every maybe 5 or 6 years, I'd come back for a week and visit my family, but I never really had strong ties to Taiwan. I didn't know my family super well. My Chinese is a little bit garbage. And just, briefly, I know about the culture, but it just didn't feel like my culture. And so I thought, it would be such a fitting thing to do to spend it abroad. And I like traveling, and I like, trying new things and going new places. So I thought, oh, that would be really interesting to come here. So honestly, it was largely influenced by that. And obviously, all this things about it being probably one of the best microsurgical centers didn't hurt here either. But your question about why something clinical is just, I do, at the end of the day, I do like to operate, and really I do like surgery. And I think just the more places you experience, the more things you do. And I think, it's definitely one of the benefits of being at Stanford. You go to a lot of hospitals and you meet a lot of attendings, and just like anytime you do a new operation or you work with someone new, you're like, oh, I didn't realize that, or I learned something new. So I don't have external funding. So what I do have is a scholarship here, and so they choose a few people to give a scholarship to. It's not a lot of money. It's like about $1,000 USD a month or so, but being said, the cost of living in Taiwan is very, very, very low. Like this apartment, which I will not show you given how messy it is at this time, is about $300 a month. And like cost of living, and just like, you buy at like a gourmet meal for $1 or $2 or so, and everything is a lot cheaper here. So $1,000 goes a long way, and I'll probably still end up net positive. But I wouldn't say, this is like a money earning fellowship. It's definitely something that I chose, not because of the money, but because of other reasons. Interestingly, before I was I was more considering craniofacial, and then actually having, I think, a lot of things in life are like that. You don't really like have a certain path and you go a certain way. There's so many different things that influence you. And I think just like, hearing about this fellowship and learning about it for other reasons made me think, oh, that's really interesting. And then I kind of read a lot into head and neck reconstruction particularly, and I realized, oh, that is very interesting because I like craniofacial given, and I really like the anatomy of that area. And so you get that part, and then you have like, the microsurgery and the actual reconstruction. And so there's just so many options I didn't know about before. And so I think just by the process of learning about the fellowship, and obviously my exposures at Stanford made me really, really like head and neck reconstruction. So I think I would like that to be a big part of my practice in the future. I mean, who knows where it'll take me, but I still think, I'm still interested in craniofacial, and I definitely, maybe half the time still want to do head and neck reconstruction on top of it. It's definitely a lot of training. I don't think it's for everyone. I definitely think it's a personal choice and something that you really have to think about for yourself too, because it is an extra year, and a year is a long time. But at least for me, I've really, really enjoyed this year. I don't know how I could have, done it any other way. I think there's so many benefits. I think one of the benefits is definitely that, I think we're at this time in our lives where we're still young, but we're making these huge life decisions. And generally what we've been used to is, you go like 4 years at a time, 4 years undergrad, 4 years med school, etc. And this is probably the longest period of time that you're committing to something. And to, really like put that in, you kind of like blindly commit in the beginning, and then 7 years later you become a plastic surgeon, you become what an actual surgeon. So it's really nice to have a breather in the middle and to really kind of reassess that, because you're so busy during residency, you're not really taking time to consider your career path, doing all that stuff. You're not taking quality time, you're just resting or going from day to day. And so this year, I think I at least personally have done a lot of reflection on what I want in my future, how I want my life to be structured, and really to think about things. I think that's probably the biggest benefit of this year. Another thing, obviously, is, the professional development part of it. So, you really take this year to work on something, and you think about your life and everything is go, go, go. You don't really have a time to just be like, I'm just going to take a year off and just do whatever, maybe it's people in other businesses, or if you lived in Australia, you would have that opportunity. But I think in the US, in medicine, you're just always going from next step to next step. And it's so nice to just be like, okay, this is a year that I'm just taking to myself, and I'm going to do what I want to do, and it's free for me to do whatever I want to do. And whether it's like explore something else or to further my career in a certain way, and it's just like it just feels like you have that freedom, and it's really nice to have that. And I think, I spent a lot of this year too doing my personal life things, getting to know my family in Taiwan, reconnecting with some of my friends back in med school or college who I've been ignoring for 3 years, and really rebuilding those relationships as well too. My dad also, he came to Taiwan with me for 3 months. So I really, I only saw him for a total of, I think, 6 or 7 days in all of residency before. And I got to spend 3 full months with my dad here. So I think it's just invaluable for your personal life too. It is a long period of time. And so, especially, when you're considering PD year, a lot of people just, sometimes you're thinking, oh, I want to do something that is like, like impressive to the people around me, or can do this. But sometimes it's really important to take some time for yourself and do something that you really, really want to do. And it's a year of your life that it's like a year of your life kind of gifted to you, that you can really be truly free and do what you want to do with it. And yeah, I think like maybe a little bit on the lines of the wellness stuff I was saying before earlier too, but it's really nice to be able to take this time and to really improve upon the like aspects of your life that you have maybe not had time to work on, or things that are important to yourself, and to really think about that.